So what do we know about the pathophysiology of REM behavior? We know that a REM behavior disorder is a disorder where people manifest as they act out their dreams. Mainly the dreams have a content where the person is defending themselves, or so they tend to be violent in nature, in the sense that they're defending themselves from whatever is happening in the dream, even though these people don't tend to have a history of violence or trauma, but that seems to be a common theme, and they act out in dreams, and they seem to be fighting or having these very, very dramatic movements, even though that's not always the case. We usually rapid REM behavior disorder when it happens in middle age to older adults. It happens associated to deposition of α-synuclein, or associated with α-synucleinopathies, such as Parkinson's disease or dementia of Lewy body. And it seems that the early deposition of α-synuclein in the brainstem causes damage to certain nuclei that does not allow for the REM atonia to persist in REM sleep. So when that happens, then the usual REM sleep with atonia that we are able to observe during polysomnography, the REM sleep with atonia that we usually observe in polysomnography does not happen. So now the person is half REM sleep without atonia. So we see actually REM sleep, but the muscle tones increase, and then this allows for the person to then act out a dream, mainly because of the early deposition of α-synuclein, again in the medulla and those brainstem structures. These can also be exacerbated by certain medications, such as certain antidepressants, and also we can see it also in people with very severe sleep apnea, when they have severe events during rapid eye movement sleep, and they end up acting out their dreams out of more of an arousal out of REM sleep, as opposed to being related to an actual deposition of α-synuclein. There actually is more associated to respiratory events of sleep apnea. We call this kind of a pseudo REM behavior disorder. It's more related to the respiratory events. But again, this is our more in the differential diagnosis, but again, within the pathophysiology that's of REM behavior, we commonly see, associated with α-synucleinopathies in those that are middle-aged to older adults, while in younger patients, is usually associated with narcolepsy.